Uh, First of all, thank you so much for the invitation. I've really been looking forward coming here this afternoon, talking about innovation, public sector, sharing data, and of course, sustainability. My name is Ingvild Araldsen Blom, and I work at Sitasteria here in Oslo. On a daily basis, I work a lot with public sector, primarily here in Norway, but also in the rest of the Nordic region. And one of the main challenges, as I think you all know, is how we, as a society, will become more efficient, more innovative in the coming years. And Norway, like most other countries in the world, has committed itself into the UN's sustainability goals. And to achieve the goals, however, we have a job to do. The public sector is completely dependent on using innovative and digital solutions in a completely new way. Without this interaction, we will not succeed. However, this is challenging as the public sector has procurement rules, financing models, and organization models that does not always correspond to the current needs. And that's why I think meeting places like this are important, in order to be able to influence the Norway of tomorrow. Okay, so what are the digitalization goals of the public sector? Together with various actors in the health sector, we have defined 4 overarching goals. The first one, digital leadership. Develop new business models, work process, and flexible management, and also facilitate cost-benefit change management. And this is something I'm sure many of you know. We need to focus on digital leadership, both in public and private sector. The healthcare industry is sustainable, but if we are to bring these big changes, we must dare to think of new solutions. We must challenge financial models, forecasting routines, organization models, and processes. And experience from, for example, Sunnaas Hospital shows that digital following up with certain patient groups both increase user satisfaction, reduces costs, and is sustainable. But of course, the challenge is that people that can make decisions must dare to think new. The second goal is big data and artificial intelligence. Of course, we want to control diseases. We want to compile analysis. And we want to look at the variation in treatment from and outcome. For this goal, new technology, sharing data, innovative solutions, and digital leadership are essential. Norway has one of the world's best health registers and historical data. And this can give us a unique advantage within the healthcare industry. I Næringsdepartementets strategy, Hele Norge eksporterer, the export of health technology is not currently mentioned, and I really hope that will change soon. The third goal, UX, navigation and visualization, is there to get better access to knowledge-related health data and an intuitive and holistic access to decision support. I don't know if any of you know HoloLens or HoloCare. But HoloCare empowers surgeons with a new perspective, so they can spend less time and energy trying to see the problem and more time trying to solve it. Our platform has been designed to automatically generate 3D models from medicine and use mixed reality hardware to put them straight into the hands of the clinicals. And with HoloCare, clinicals will have a new perspective on surgery and helping them develop better plans and deliver safer surgery. And the last goal, best practice, security and integration, looks at analysis based on data from relevant health registers. As I said, we have one of the best health registers in the world. And of course, privacy and regulatory use of patient data. Okay, so the healthcare service in the future. What we hope is that it will be efficient, comprehensive, and fair service for everyone. That means that we have to ensure the quality in the service. We have to reduce unwanted variation linked to form of treatment and demographics. That's a huge problem today. And we have to investigate and ensure quality and efficiency at the patient's journey throughout the health service, with particular regard to the patient. And we have to have streamlined methods in the special healthcare service, and also straight knowledge-based decision support and priorities. And I also agree, the current status is not the lack of technology. We need to use the technology in collaboration with each other for positive results. And in order to achieve this, we must collaborate across the overall goals of digital leadership, big data, IA, visualization, and best practice. And in that way, Norway will become more sustainable. Thank you.